Running on adrenaline and caffeine, Nicole Stewart thought she was like any other busy, full-time working mom until her body told her otherwise.
Come down.
Go down.
On today's All Things Heart, how her heart forced her to slow down and get her rhythm back on track. Good morning, I'm Alexis Del-Cid. Welcome back to All Things Heart. Today's guest has a lesson for all of us watching. Slow down and listen to your body. For Nicole Stewart, it was an alarming incident that prompted her to get checked out. And then doctors discovered the problem was with her heart. 33-year-old Nicole Stewart doesn't really know what personal space feels like. And it's not just because of Apollo and Minnie, who stick to her like glue for much of our interview.
No, Noah.
With 5 dogs total, a cat, 3 teenagers, a husband, and a full-time job, peace and quiet is a rare commodity.
I ran on caffeine some days, if I had to, there were some days I had to be 5 places in one day with kids, school events, sporting events.
But about a year ago, something unexpected brought Nicole's jam-packed days to a screeching halt, culminating with this. This is also Nicole undergoing a heart procedure a few months before our interview after a frightening episode at work.
Went to go sit down at my desk and I felt my heart starting to race. I even looked down at one point and I could almost just see my heart beating through my shirt, and I was like, okay, something's wrong. I need to get to an ER.
The doctors there told her she was having a tachycardia event. Tachycardia is when the heart beats too quickly, typically more than 100 beats a minute at rest.
He described it to me as almost like an extra vessel in the heart that was pumping that shouldn't be, and so my heart was just like double working almost.
They were able to get it under control, but told Nicole she needed to see a cardiologist. And that's how she met electrophysiologist Dr. Siva Soma at the University of Kansas Health System, who you see here performing the procedure on Nicole.
Now we're going to try to create a shell of the heart without using fluoroscopy.
He was great. He was very confident, explained the whole procedure to me, just made me feel very confident in his work. He said, we do this all the time.
Dr. Soma ultimately diagnosed Nicole with supraventricular tachycardia, also known as SVT, meaning the irregular heartbeat was originating in the upper chambers of Nicole's heart. In order to treat it, Dr. Soma would perform an ablation, reaching Nicole's heart by going through the veins in her groin and using radio frequency ablation, or heat energy, to destroy some of the tissue in that upper chamber to keep those signals from being sent. Nicole was home the very next day, feeling like a new person.
Today, physically, so much better. I have normal energy levels again. I'm able to sleep better. Just all around, just more like my old normal self.
And she's also made some changes to her life, like cutting back on caffeine. And most important to Nicole, she now makes time to see a counselor twice a month to help manage her stress.
She's taught me some breathing techniques. It's very important because, especially for someone like me who constantly is busy, so it's very important to listen to your body and pay attention, because again, when you're a busy parent, you're like, nope, I'm fine, I have to keep going. You have to take care of yourself to take care of everyone else, and parents really forget that when they're in the thick of it.
We are so pleased to have Nicole here with us today, along with her electrophysiologist, Dr. Siva Soma, and we also have registered nurse Lucas Mine. Is it Mine or Mean?
Mine.
Mine, okay. Thank you both for being here. And Nicole, thank you for joining us and sharing the conversation. We also work with Nicole, so we know her so well. And this was really scary when that happened to you. I remember you calling us and saying, I'm going to the ER.
Yes.
Right after your procedure, you said you felt instantly better. Now that it's been months out, what do you feel like?
Just feel like my old self. I'm able to get up in the mornings. I'm able to drive. There was even You know, at one point I didn't even feel safe driving anymore because I was so tired, and I never knew if, you know, my heart was going to start bothering me. So I'm just able to function like a normal human being again.
And you kind of have to with your house.
Yeah.
As full as it.
Yes.
Who's watching the dogs today?
My husband.
Okay, there you go. Good, Robert. I'm trying to imagine what it was like to look down and see your heart pounding through your shirt. What were you thinking?
At first I thought I'm going to pass out. Mm-hmm. And I did kind of look around. I was at our satellite office, and I don't think, there was anyone else there, so I decided, yes, I had to get to an ER. I don't know. It was,
Did you drive yourself?
I did.
Oh. Was that a mistake, Dr. Soma?
Yes.
Should she have driven herself?
So if you're not feeling dizzy or lightheaded, I know most patients with supraventricular tachycardia do not pass out. You know, so they have palpitations, they have dizziness and lightheadedness sometimes. So if, you know, we tell them stay hydrated, and if you're doing okay, it's not unreasonable to drive. But obviously, if there is somebody else to drive, it's better.
Yes.
We're glad you made it. Thank
you.
goodness. Dr. Soma, how do you explain SVT to someone who has no medical background?
So SVT, supraventricular tachycardia, is an umbrella term used to describe fast rhythms coming from above the ventricles. So it's the top chambers or the connections in between the two top chambers. You know, there are different types of supraventricular tachycardia. There is AV reentrant tachycardia, AV nodal reentrant tachycardia, and atrial tachycardia. Those are the three main common types.
And do all those names just mean it's coming from a different part?
That's right. You know, so they're still coming from above the ventricles, but the atrial tachycardia is coming from one area where it just decides to fire away. The AV node reentrant tachycardia is in between the two chambers of the heart where the AV node is. You know, and the AV reentrant tachycardia is an extra connection between the two chambers that leads to a short circuit.
And so which one? Nicole had SVT.
Yes. So her subtype of SVT was AV nodal reentrant tachycardia called AVNRT.
And she had an extra something in there?
So sometimes what happens is an extra beat comes in, and then the way I describe to patients is that there's the highway and then there's the regular way, you know. So normally everything goes through the highway, you know. If there's an extra beat that comes in, and then it just says, okay, the highway is blocked now. So it's going to go over here, and then there's a small circuit that happens over there leading to the fast heart rate.
Oh, okay. That's a great way to explain it. How common is it for a young woman to get SVT, and who's most at risk?
So the incidence of supraventricular tachycardia is about 2 to 3 per thousand. So it's about 0.2 to 0.3%. You know, the different types, the two most common types, happen in younger people. You know, unfortunately, females are more likely to have AVNRT than males. You know, they're twice more likely to have the SVTs. You know,
is it because of the structure of their heart, or because Nicole is a mom working with 5 kids and 3 kids, 5 dogs, and 1 husband? Is that what makes women more at risk?
No, I don't think that's the case. But studies have shown that the two most common types, I think, you know, it's just a more female predominance. You know?
Lucas, you help run the clinic. You manage everything in there. You talk to the patients often. You're the first one that hears from the patients. So when someone calls the office, Nicole came from the ER, and so she was referred. What do patients normally tell you when they call?
Well, like she said before, you know, she felt her heart racing, you know, like it was beating out of your chest. That's pretty common, especially with a heart rate above 150. You know, your heart can get beaten pretty quick, and you can start feeling lightheaded, like Dr. Soma said, dizzy. We usually like to look out for any of the red flag symptoms, so shortness of breath, chest pain, you know, severe lightheadedness, feeling like you might end up passing out. Those are the ones that we want to look out for, you know, immediately, to make sure that the patient is not only safe, but safe to proceed in the way that we would like them to proceed, either to the ER or to find out if this is going to be a continuous thing that's going to happen for, you know, hours to, you know, minutes long, or if it's just something that's short and short-lived, so that way we can talk to Dr. Soma and figure out what the next step should be.
Nicole, did you have chest pain too?
I wouldn't say no that I had chest pains or like any feelings that were coming up right before it happened.
But the racing heart and feeling like you were going to pass out.
Yeah.
That was plenty.
Yeah, that was enough for me.
We want to let our viewers listen to something, because the typical heart beats about 60 to 100 times a minute. Let's listen first to what that sounds like. taught us that in school. Love
Yeah.
dub, love dub. That's a heart beating 63 beats per minute. Lucas, what's a typical heartbeat for patients with SVT?
Usually anything above 150 to about 220.
Okay, so let's listen to the difference because we have a heartbeat of 158. Let's listen to that. That's fast. Nicole, do you remember what your did they tell you what your heartbeat was at?
I think mine at the ER, I believe was 163.
This was higher than that.
Yeah, a little bit higher.
Why does a heart with SVT beat so fast?
So what happens is when you have a short circuit, it's almost sometimes beating twice, so it goes and normal heartbeat starts from the top,
Okay.
some of the sinus node, and then comes down to the AV node and then goes down, so as you pointed out, it's between 60 to 100, When you have a short circuit, what happens is it can go back and forth twice.
The loop you were describing,
Yes,
the
that's
highway
right,
and the
and depending upon the adrenergic tone, sometimes it can go even all up to 220, or sometimes in older patients, or if they have already been on beta blockers, then the heart rate is a little bit lower.
Okay.
So it can go anywhere between 150 to 220 for that reason.
So Nicole was describing she was in a constant state of exhaustion. Was that because what was causing the exhaustion? How was the SVT causing her exhaustion?
Makes sense. So what happens sometimes is like when the acute symptoms, right? So when you have a sudden fast heart rate, those symptoms can go on for like a few minutes to a few hours. And after that episode, what sometimes happens is that it's almost like you ran a marathon, So you just finished running a marathon, your heart is working twice or thrice as hard, So that can sometimes cause exhaustion. And symptoms of tiredness and fatigue. And long-term effects of this is that sometimes people don't notice it as much, and they notice the heart rate in the 150s, 160s. So if you're having this for a really long time, the heart doesn't like beating at such fast heart rate. So it can cause what's known as a tachycardia-mediated cardiomyopathy. So it can lead to the weakening of the heart muscle.
Okay. So that explains you were running a marathon in your regular life with all your kids and your errands and everything you do, and then your body was running that extra marathon with your heart. So not everyone diagnosed with SVT needs a procedure to fix it. Why was Nicole's case different?
Great question. So, there are different options for treatment of supraventricular tachycardia, SVT. What we do is, you can give medications like beta blockers, calcium channel blockers, anti-rhythm drugs. The efficacy of these medications is about 50 to 60%, and also medications have side effects, So that's why in the 1990s, radiofrequency ablation came up for treatment of supraventricular tachycardia.
In the 1990s?
1990s,
Okay.
That's when it started, and then since then we've done thousands of procedures. So what has been shown is that the SVT ablation, the efficacy rate for taking care of this rhythm is more than 95%, at least for the two most common ones.
Okay.
And nobody wants to be on a medication for the rest of their life. So in somebody like Nicole, who is young and who doesn't have a lot of other medical conditions, and she has a lot of symptoms, then we offered that ablation is a very safe and effective way of taking care of her rhythm.
Lucas, do you ever get a call where you think, well, this probably isn't it, so you should go here? Or does every person who calls need to see Dr. Soma? How do you know what the difference is?
Not necessarily. So usually we assess for red flag symptoms, so anything super urgent that we need to treat right now. Most of the time, if their episodes or whatever's going on is short-lived, it kind of gives us some time to assess the situation, find out, how often is it happening? When is it happening? Are there any triggers? How much caffeine have you drank today?
Yeah, we're going to get to that in a minute.
Hydration is a big one as well.
Right.
Any of the risk factors that may be involved to essentially find out what exactly is happening.
We have some really cool video of Nicole. I don't know if you think it's cool, but you let us tape your procedure, and Dr. Soma, thank you for letting us into the procedure room. Thank you for giving us permission. This was so interesting to see. This is treated with ablation. So Lucas, how would you explain ablation to someone who calls?
So in short words, it's a short, simple procedure that uses catheters that go through the groin to access your heart. And basically what we're doing is scarring your heart. Putting little scars on your heart so that way those signals can't get through from wherever they're coming from. And usually during that procedure we can make those signals happen. so that way we can find out exactly where they're coming from to make sure those scars are in the right spots.
So the scars are like little roadblocks?
Yep.
And do you always, Dr. Soma, do you always use heat? Because I've heard ablation with cold as well.
That's right. So you can do cryoablation or radiofrequency ablation, So about 90 to 95% of the times we use radiofrequency ablation, for this type of rhythm. So there are obviously different rhythm problems, and we use different sources of energy for treating different rhythm problems. But for AV, NRT, and SVTs, we start off with radiofrequency ablation. Most places at least do, and then if we have problems, or if there's there are other reasons, then we switch to cryoablation.
When we look at that video of Nicole, what's also very cool is seeing how many people were involved in that procedure. It's a whole team. How are you finding, you're working there, are you at the camera there, or is that someone else operating?
So I'm next to the operator over there. So generally, as you pointed out, it's a team effort. So there's nurses, there's technicians, and there is industry people who are helping us. So I'm generally over there, right next to the table, and we're a teaching institution, so we have fellows and residents who are there. What we do is we put catheters through the groin, through the femoral vein, put soft catheters into the heart, and then what we try to do is recreate this rhythm that she had. So we're able to do programmed stimulation, give extra beats so that we can recreate the rhythm that she has. Then after that, once we've recreated the rhythm, we confirm that this is the rhythm that we're thinking it is. Okay?
Oh, so you're making her heart race during the procedure, and that's how you're finding the faulty pathways then scarring those?
Yes. So sometimes, because there are different types of SVT, sometimes it could be what's called AV node reentrant tachycardia, where we have to cauterize in the middle of the heart. Sometimes it could be AV reentrant tachycardia, where there's an extra connection between the two chambers, and then we have to go to that area and then cauterize it.
You are electricians of the heart.
That is right.
That is so interesting. How long after your ablation did you notice a difference?
Pretty quickly, especially about a month after I stopped, because it almost had gotten to a point where I was just like waiting for it to happen, and I finally, like after the procedure, told myself, okay, I don't have to keep feeling my heart, I don't have to keep worrying that something might happen. So I'd say really about that month mark.
Was it causing anxiety, anticipating it possibly happening?
Yes, I had a lot of anxiety, like anticipating an episode or to come.
Did one ever come after the procedure?
No. No, knock on wood.
Knock on wood. That's great. This isn't wood, but we'll find some later. You talked about the lifestyle changes you made, cutting out caffeine and implementing these breathing techniques. How do you implement the breathing techniques?
I do a lot of those usually at nighttime, like at the end of the day, so that just my mind and body are able to relax. I feel like it's helped me get to sleep faster, which has really helped a lot too.
Is it almost like a meditation that you do?
Kind of, yes. Yeah, it really, she taught me the breathing techniques, and then the other one I do is you say like you'll like ball your fist and hold for 5 seconds and then breathe out to release. But you do that all over like your feet, legs, arms, just to really help your body relax. And it does help me fall asleep. I feel faster than what I used to.
She taught you?
Yes, yeah, my counselor.
Okay, and how often do you see her?
Twice a month still.
That's great. We have some great questions coming in and some comments. So if you have a question for Dr. Soma, Lucas, or Nicole, or you'd like us to read a comment out loud in the program, you can send it to us on YouTube, Facebook, and the All Things Heart email. All the links on how you can connect with us in real time are right there on your screen. Want to talk about the caffeine a little bit more, because most people love their big cup of coffee, or Nicole, in your case, what was it, a big gulp?
I drink, Coca-Cola a lot, like the bottles.
How much were you drinking a day?
I mean, I would drink 4 or 5 sodas a day, and sometimes even maybe a coffee in the morning.
So hearing that, do you think it was more stress that caused this in Nicole, or was it the caffeine?
So there are triggers that can, that can start this rhythm, like caffeine, alcohol, stress. Those are all
alcohol
triggers.
Can cause it?
Yes. So what happens is you have an underlying substrate, meaning some people are more likely to have this. So in them, not everyone who drinks caffeine gets SVT. So there's an underlying substrate, and then these triggers can precipitate those rhythms. They can bring them on.
Lucas, you were nodding your head yes about the alcohol.
Yeah.
Do you hear that from patients, that it happens after a night of drinking or when they...
Sometimes. So the weekends are a big one. So like on Monday morning, we'll have a lot of patients call and say, you know, I had a couple episodes yesterday. And I was like, okay, what were you doing yesterday? Football, you know, it's football season. You know, I had a couple drinks with my buddies. I'm like, okay, that's more than likely probably a trigger. So I usually tell them to watch out for alcohol consumption, you know, make sure that it's in moderation, and try to hydrate as much as possible if they are going to
imbibe.
And yes.
That's so interesting because, Dr. Soma, I've noticed once I hit I'm turning 52 this year, once I hit 47, I could not have more than one glass of wine at night, or I would lay down and what is it about age that causes that? It's not a fun change. It's not a fun change.
So there, obviously, alcohol, caffeine, all of these have different effects and different rhythms. You know, so there are some rhythms that you know, are more likely to develop, like atrial fibrillation. There is a more of a connection with alcohol. You know, there are some other rhythms which have less of a connection, obviously. So for SVT, I would say caffeine and stress are bigger triggers than alcohol.
Okay.
You know, but obviously. I think I've seen it myself also. I can't drink as much as I was doing,
right?
Younger, right? You know, so what we tell patients is that, you know, moderation is good. You know, we all want to have a cup of coffee in the morning, right? You know, so if you're having like 5 to 6 cups of coffee or, like, you know, other energy drinks, so that's not so good. You know.
Lucas, what's the difference then if Nicole works out now and her heart starts pounding? How is that different from the pounding heart from SVT?
Usually after you're done working out, your heart rate will return to normal if that's what's causing your high heart rate as you're working out. Versus if it is SVT, that heart rate can happen at any time, like it happened to you. You went and sat down at your desk and it just started happening. So that pathway just kind of has a mind of its own.
No rhyme or reason to that.
Yes.
We do have some
That's
questions.
a great way to describe it, you know. So exactly, I tell my patients that if you exercise, you know, your heart rate goes up and it comes down after you stop exercising.
Right.
You know, some people it might take a little longer, but if you have an abnormal rhythm, it doesn't come back. You know, it stays elevated for a longer period of time. You know.
Can you feel the difference when you work out, that it's completely different heart pounding than when you had your episodes?
Yeah, because even now, like going, you know, taking my dogs for a walk, it's not even something I think about now. But before, like, I would worry. Like I walked slower because I was so worried something would, you know, come up and I'd just be out there.
That's no way to live.
Yeah.
Your walks are supposed to be relaxing and fun. We have some questions coming in, so I want to get to those community questions. Kathleen Ivanova writes, that's an incredibly relatable and powerful story. So many people, especially busy parents, dismiss symptoms like that as just stress or exhaustion. Her story is such an important reminder to listen to our bodies. With that, Kathleen wants to know, what advice would you give to others who might be brushing off similar warning signs? Nicole, do you want to handle that?
Go get checked. You start with your primary care. You know, that's the best route, but don't ignore it, because then it's going to turn into something more eventually, like with me, where you end up in a procedure.
Right, with your bonnet on. You did look cute with the bonnet. It's our little Nicole. That's such great advice. Sam has a great question. Sam wants to know, why do you go through the groin? Is that the only pathway?
So we can go through the neck, but most commonly we go through the femoral vein. You know, we need to put 2 or 3 catheters. Sometimes we use the neck also, but most of the times we go through the femoral vein because the direct connection from there into the heart. You know.
Okay. It's a quicker pathway, more direct.
And it's easier also. You know, just based on how we manipulate the catheters, it's easier to do it that way.
Jill writes, I've been living with this for 30 years, and they told me it got worse the older you got. Is that still common thinking? Lucas, what does your experience with patients tell you?
They always tell me that getting older is hard. So
it is, right?
I can see where that's coming from for sure. But I mean, just over time, as the heart muscle grows and gets, you know, more use, it can over time start to
Yeah, so there are different types of
weaken.
tachycardia. So atrial tachycardia, and some of these, they actually get worse with age. There are other ones, so like AV node reentrant tachycardia or AV reentrant tachycardia. Sometimes they can get worse with age, and sometimes they, very rarely, they don't happen. They go through this phases where you have a lot of them, and after that it goes down, but that happens rarely. So different types of SVT, so the ones that are atrial tachycardia or other rhythms, they get worse with age. The other ones, sometimes they do, sometimes they don't.
Was Nicole's the kind that
Nicole's
would get
is
worse?
not the one.
Okay.
Yeah.
So she's good.
But she had so much of symptoms that it's you don't want to be on a lifelong medication, so that's why we chose this pathway where you do the ablation. It's a safe and effective manner to take care of this.
Is there ever a patient you talk to where you think, hey, a medication is a better fit for you?
That's right. So if they're older and if they are not very mobile and they have a lot of comorbid conditions, then sometimes we try medications first in them.
Jeremy Yenser has a question. He wants to know, what's the recovery look like after that ablation? And for Nicole, how quickly did you feel better? So first I'll go to Nicole. How quickly did you feel better?
I felt pretty good after about 3-4 days. I was already up back
doing Nicole.
Yeah, doing more normal things, and I had just taken a week off and then was back to work after that as well.
Is Nicole's recovery?
That's what we see most of the times. So
Okay.
sometimes we either send him home the same day or next day. After the procedure, you're bed rest for 3 to 4 hours, and after that, I just say take it easy for a week. And then after that, just go back to slowly increasing your activity. And if you're exercising, then go back to exercising, but just slowly ramp it up.
Is there a possibility that her specific kind of tachycardia or SVT could come back?
So the success rate for this ablation is about 95%. So there's a 5% recurrence rate, but most of the times these rhythms were able to take care in a safe and effective manner with a very high success rate.
Another viewer wants to know, Laura asks, is this genetic? And is there a test that anyone can request at their doctor's office to see if they have it?
So mostly SVTs are sporadic. There are some genetic syndromes that can cause AV reentrant tachycardias, but overall, the majority of them are sporadic. So I wouldn't. There's no genetic test that you can see if you have an SVT.
Lucas, do you ever have parents calling you that say this is happening with their children? And what's that conversation
A lot
like?
of daughters of older patients call and say this is happening to my mom or my dad. Not many parents call and say that it's happening to my children. I don't really get that a ton, but we do get a lot of patients that say I'm having a fast heart rate. I'm not sure what's going on, and then we just kind of dive in to see what's happening at that point.
We have a question, this is from Amelia about caffeine, Nicole. Amelia writes, I can't cut caffeine out without a splitting headache. How did you do it, and do you ever sneak any caffeine?
I do still sneak some, yes, here and there. I did actually have to get a medication, yes, to help with my headaches.
With the
first
withdrawal
few
of
months.
caffeine?
Yes, yeah.
That's interesting.
I saw a neurologist, and I was taking amitriptyline to help kind of ward the headaches off for a while, because it was hard.
I didn't even know that was an option. I know when I've tried to not have, well, I don't really usually try to not have coffee, but if there's a day where it doesn't happen right away, you get that headache and that splitting headache. So do you ever prescribe amitriptyline to help patients get off the caffeine?
So I tell patients that we want you to live your life. We want you to have some simple pleasures in life, right? We all want to have a early morning coffee or whatever it is, But moderation, that's what we recommend. If you're drinking 6-7 cups of caffeine and you have a lot of stress and anxiety, then dealing with that is better. We generally don't prescribe medications for that. Primary care physicians and psychiatrists sometimes can help with that.
But no more 8 sodas a day.
No, not that many.
Good. As we wrap up this discussion, I'd love to get today's takeaways from our guests. Nicole, what's your message to other moms watching this? And I ask you this because during our interview, you really stressed the importance of taking care of your mental health.
Yeah, I think it's just very important for us moms to remember that we are human beings and that we have to take care of ourselves to be able to take care of everyone else around us. And it's very important for me to start doing a little bit, self-care, seeing my therapist, just to kind of ground me and remind me, hey, you are human too. you've got to take care of yourself so that your kids can live, you know, a long, happy life with you.
Amen to that. Lucas, what's your message to our viewers watching?
I think Nicole had said it earlier, you know, if you notice something happening that you think may not be normal, you know, listen to your body, go get checked out, you know, call your doctor, primary care, whoever, you know, you can get into to see sooner rather than later. Just to check. That's all it is. It's just a check, just to make sure everything's working as it should.
And Dr. Soma, what is the takeaway you want from our viewers?
No, I agree with both of them. You know, is slow down and then listen to your body. You know, also in regards to supraventricular tachycardia, it's a relatively common rhythm that we can take care of very easily. You know, in the last 30 years, we've made great progress. We're able to do this in a safe and effective manner with a very high success rate and a very low complication rate. So, if you have one of these, you don't need to be taking medications all your life. You know, especially for younger people, do not be afraid to get an ablation. You know, and totally agree with everything else that Nicole and Lucas says. You know, just slow down, listen to your heart, listen to your body, and then take care of yourself.
Take it easy.
Yes.
Dr. Soma, thank you. Lucas, thank
for having
you.
us.
And
Thank you
Nicole,
for
thanks
having
for sharing your journey. I know you were nervous. When I came in, she was doing her breathing exercises. What is it? You clench your fists?
Yeah.
Take it deep. Show me how you do it.
So you take your breath in, clench, and then as you exhale, release.
I like that.
We all need to do that.
Yes, we'll be doing that too. Thank you, Nicole.
Thank you.
And thank you to our audience for joining the conversation today. If you'd like to watch or share any one of our previous episodes, they are all out there. Just scan the QR code on your screen right now. That will take you to links of our previous episodes. We'll see you right back here tomorrow morning.
Coming up tomorrow on the Morning Medical Update, a devastating knee injury sidelines a 16-year-old. I'm Jessica Lovell on the next Morning Medical Update. Gabe Anchieta is a fighter. Less than a year after surgery, he's seen some big wins on and off the field. Friday at 8.